Hi everybody, my name is Alexander Kam. I work at M. Jamil General Hospital in Padang. I completed my postgraduate diploma in endocrinology program at the University of South Wales in 2022. The Merck Foundation fully supports this training program. This training program method suits me, who has a fairly busy schedule. At first, I had difficulty adjusting to my plan of activities. However, after that, I really enjoyed this educational process. The tutors who accompanied us really motivated us to learn and learn more. I like how the tutor triggers discussion with a case that will be discussed together. And of course, the passionate group members from different countries. I am so grateful to have had the opportunity to be tutored by a fantastic tutors and a group of great people. I achieved so much after completing this course. I work in 2 hospitals, one in public hospital and the other is private hospital. In the public hospital, I work in 2 roles also, which are also as a lecturer and as a healthcare provider. As a lecturer, I was entrusted to teach students and residents currently studying in the endocrine and metabolic divisions. In providing health services, I am also trusted to manage patients with endocrinological disorders in outpatient and inpatient clinics. These hospitals has a specific outpatient clinic for patients with endocrinological disorders. This year, the government initiated the establishment of diabetes centers in the several government hospitals throughout Indonesia. And I was entrusted to be one of the team members at this hospital. We have also started discussion with other multidisciplinary disciplines to discuss complex endocrinology cases. These activities I carry out are rated well by hospitals and the health of ministry. I was given an award directly by the Minister of Health of the Republic of Indonesia as the Hero of the Month in November 2022 because of my performance in endocrinology services, internal medicine services, and my involvement in helping hospital management to make hospital better. I'm also active in the endocrinology organization in Padang, whose member consists of multidisciplinary specialist doctors. Through these organizations, we have conducted several scientific meetings and outreach to the general public, which we plan to carry out regularly. The hope is that with this routine counseling, these routine activities, more people will be exposed to and understand more about endocrinology disorders. The benefits of this course are excellent. As a medical specialist, I'm much better at diagnosing patients with endocrinological disorders. My eyes are more wide open when examining patients that have an endocrinological disease. The management provided is also more comprehensive. I'm quicker to conduct consultations with other disciplines and even hold multidisciplinary discussions to discuss patients with complicated cases. This will certainly provide excellent benefits for patients. Moreover, this hospital is the last referral hospital in the Sumatra region. This means that most of the patients are expected to be managed well by us here in this hospital. If diagnostic tools or treatment modalities option constrain us, we will only refer this patient to Jakarta. By completing this program, I have the provision and additional ability to discuss with hospital management to provide diagnostic and therapeutic modalities that do not yet exist in this hospital but are needed to treat patients with endocrinological disorders. This, of course, is very helpful for patients at this country health level. most of the patients in this hospital are fully covered by the government. With human resources and complete diagnostic and therapeutic modalities, it will undoubtedly benefit for this patient so that later their quality of life will improve again. To date, we have successfully managed several cases such as Addison's disease, empty cell syndrome, hypogonadism, complex thyroid carcinoma, and many other cases that we treat in a multidisciplinary team. I wish to establish a center for diabetes studies and endocrinology studies. We will conduct research and discussions at these study centers regarding endocrinological disorders. We can also share knowledge with doctors interested in endocrinology through these study centers. And we will also be active with endocrinology organizations, sharing knowledge with the public so that this knowledge can benefit by the wider community. Besides that, with the initiation of the diabetes center at these hospitals, I also plan to develop it into endocrinology centers. This center is expected to facilitate services to patients. The patients at this hospital come from the same city at the hospital and also from the other towns and other provinces. With the endocrinology center, the benefit obtained by patients are in the form of multidisciplinary approach so that the patient satisfaction with treatment will be much better. Because of this excellence of this course, I highly recommend it to my colleagues. Human resources who consistently improve their abilities by participating in training programs are essentials in advancing health services in the region. Thus, I would like to thank Merck Foundation for giving me the opportunity to develop myself through this program. Thank you very much. Bye-bye.